Before leaving the operating room, a dressing will be applied to your hip or knee. We encourage our patients to leave the dressing alone. If you have questions or concerns about the dressing covering your joint, please let the nurses know. Members of our nursing team will help you to get comfortable in your bed. Please do not try to get up on your own immediately following surgery. Our therapists and nurses will be happy to assist you to get up and out of bed when you need to. Because anesthesia can temporarily inhibit urination after surgery, a Foley catheter may be inserted into the bladder to remove urine. This catheter is usually removed before midnight on your surgery day. If your legs are fully awake, you may ask to have the catheter removed sooner. You should be able to urinate on your own before leaving the hospital. If you feel like you are not completely emptying your bladder, please make sure to tell both your nurse and your doctors. There is a chance you can become constipated from taking pain medications or after being on anesthesia. We encourage patients to be aware of their daily water consumption, at least 8 glasses a day, as well as eating a fiber and protein-filled diet. It may take your body a couple of days to become regular. If you find you are having difficulty with bowel movements, we recommend trying over-the-counter solutions, such as milk of magnesia or Metamucil. If you have not had a bowel movement within 3 to 4 days after your surgery, please call our office. As you discontinue narcotics and increase your activity, your bowel movements will become more regular. When you are experiencing pain or are drowsy from anesthesia or pain medication, your breathing may be shallow. This is the most common cause of a fever after surgery. You will be given a breathing device called an incentive spirometer. Every hour, you should take at least 5 to 10 deep breaths into your lungs through the device. Your goal is to make the piston rise to at least 1,500 to 2,000 with your deepest breath. We talked a bit earlier about clots that can form in your veins after total joint surgery or deep vein thrombosis. To prevent this from happening, you'll be wearing a portable device that squeezes the muscles in your calves and keeps blood flowing through your veins. Your nurses will assist you with these after surgery. It's important that you wear them at least 16 to 18 hours a day. You will use them for 2 weeks after surgery. Those, along with regular activity out of bed, like walking, are the most important things you can do to prevent blood clots.